Arthritis technically means inflammation of the joint, but as a practical matter, it usually refers to pain in the joint, which generally occurs from wear and tear over a period of time. There are a number of things that can cause arthritis. Some of them, rheumatoid arthritis, different types of inflammatory conditions. Trauma can cause arthritis. Infection can cause arthritis. Things like gout can cause arthritis. But the overwhelming majority of people that we see in our practice, for the most part, have arthritis that is from the wear and tear over a period of time. Arthritis generally manifests itself as either pain in the joint or limitation of motion of the joint, where the patient comes to us and says they're having difficulty either, in the case of the knee, bending or straightening their knee, or they have pain when they walk long distances, or they're not able to do things that they were able to do in the past due to wearing away of the cartilage in the knee. The way that we evaluate the patient is first to take a history and then do a physical examination. A lot of times you'll see some swelling in the knee or the joint. You may see, if it's severe enough, actually a deformity in the joint, and oftentimes the range of motion in the joint is markedly decreased. You'll have stiffness, which may cause, in the case of the hip or the knee, a limp when somebody walks, or an inability to perform activities that they were otherwise able to perform. There are a number of tests that we can do, and again, some of the medical causes of arthritis, like Lyme disease or gout or psoriatic arthritis, they're basically medical conditions that are diagnosed with a combination of blood work and are oftentimes treated medically. But again, the most common arthritis that we see is generally just a wear and tear of the cartilage. The cartilage is I refer to it as the shiny end of the chicken bone. When you're eating when you're looking at a chicken bone, the shiny end is kind of sandpaper down. So instead of gliding smoothly, you get these rough edges, and people have pain when they move the joint, and they have diminished motion. As it becomes more severe, you're able to actually see this on an x-ray, where the space that was formerly taken up by the cartilage is narrowed and can get to the point where the bone is basically rubbing on the bone. So again, that's there are a number of causes of arthritis, but statistically in the patient population that we see, the most common cause occurs over time. Some of it, there is certainly a genetic predisposition to it. We certainly see patients who come in and say, oh yeah, my mother and father have arthritis, so I guess you can blame your parents at a certain level, but it can also be aggravated by other factors, such as your activity level. People that play sports over a long period of time and have multiple injuries to their joints are more predisposed to arthritis. People that are substantially overweight can be predisposed to arthritis. So there are a number of things that can cause it, but the end result is basically a joint that doesn't function as it should, causing both a limitation of function and also pain that limits the person's ability to perform what we call activities of daily living.